The brain is divided into two parts, the front and the back. The front is divided into the right side and the left side. The right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body, in addition to performing other functions. The back part has areas that control all functions necessary for life. An artery is a blood vessel that carries blood from the heart to the other parts of the body. A vein is a blood vessel that carries the blood back from these parts to the heart. There are two arteries that supply the right side. The ECA, or the external carotid artery, supplies the coverings of the brain, and the ICA, or the internal carotid artery, supplies the inside of the brain on the right. Similarly, on the left side, the ECA supplies the coverings of the brain, and the ICA supplies the inside of the brain. The back part of the brain is supplied by the basilar artery, which is formed by two arteries joining together. Sometimes, a swelling forms on one of the arteries in the brain. This can happen as a result of various reasons. This swelling is called an aneurysm. An aneurysm can be of different shapes and may be located on any artery in the brain. An aneurysm is like a balloon filled with blood, and it may rupture because of different reasons. Like if the pressure of the blood in the balloon gets too much. When this happens, the blood spills in the spaces of the brain. This is abnormal and harmful for the patient. In this situation, the patient may experience the following symptoms when an aneurysm ruptures. Sudden and very severe headache. It is described as the worst headache of their lifetime. They may also experience seizures or fits, nausea, vomiting, loss of consciousness, in addition to the headache. The patient may have abnormal sensorium, that is, their sense of orientation with regard to places, people, and time is not normal. A CT scan is the first imaging to be done to find out the cause of a problem. It can detect abnormalities such as bleeding in spaces of the brain to further guide investigation. An MRI is not always required, but when a CT does not provide enough information, the patient will have to undergo an MRI so as to gain a clearer idea of the condition. Based on the CT and MRI scans, we will proceed with an angiogram to search for the location of the aneurysm. For the angiogram, a needle is usually inserted into the artery in the right leg. Through this, a medical-grade tube called catheter is passed into the arteries of the body until it reaches the brain. A medical contrast is then injected through the tube into the brain. Images are then taken on the screen inside the DSA room. These images show details of the aneurysm. The aneurysm must be treated by either embolization or surgery. In our department, we do embolization, a treatment which is endovascular or happens inside the blood vessels. For this, we do not open the head of the patient. The same way the angiogram was done, we will put another catheter through the arterial system up till the aneurysm and then treat it by coiling. In coiling, we put spring-like things, coils, within the aneurysm until the aneurysm is completely closed. In some cases, we might have to use a stent to support the coils so that they stay inside the aneurysm. A stent is a hollow tube that is inserted into a blocked vessel to keep it open. It is important to completely close the aneurysm in one session. There are certain risks involved in this procedure. A small clot may form where the artery is punctured. There can be injury to the arteries of the brain when the catheters are being inserted. While putting the coil inside the aneurysm, it may rupture again. If that happens, we will manage it in the best possible way. However, the patient's hospital stay will increase and there may be some neurological deficit which may take time to recover. The materials that are used for this procedure are expensive. The cost of the procedure depends on the size of the aneurysm, whether the treatment requires only coiling or coiling with stenting. There are different types of stents that may be used. The cost that has been explained to you is only for the materials to be used. Nimhans does not stock these materials and they have to be bought from outside, from HLL company. The cost of the hospital stay, ICU, medicines, etc. is separate. You will have to pay 50% of the approximate cost before the procedure and the rest can be paid later. The patient will be discharged only after the complete payment has been made. In case you are eligible for any reimbursement, you may claim it with the bills that we give. We hope that this presentation has helped you understand the patient's condition and its treatment. If you have questions, you may ask now. You may consult your family and take a decision regarding the treatment. If you agree, you must sign a consent form for the procedure. The date of the procedure depends upon the availability of ICU beds, which is decided by the neurosurgery department, and availability of anesthesia. This may take some time.